Welcome back in your Health Watch. Weight loss shots are going up in popularity these days, but many people still have questions about just how they work, what the side effects are, and will it be covered by insurance? Beth Galvin has the answers to some of those FAQs.
They're weight loss injectables with names like Ozempic, Wegovy, Mounjaro, and now Zepbound. And Dr. Alicia Shelley, a Wellstar Center for Best Health obesity physician, says these medications you inject with tiny needles just under your skin have been a game changer for her patients who have weight-related health problems.
I'm seeing people who are getting off their blood pressure medication. They're not needing as much medication for their diabetes. Their cholesterol's improving. They're able to move better.
And Dr. Shelley says she gets asked about these medications a lot.
So I think the main question that people ask me are, first of all, side effects. What should I expect when I take this medication?
She says nausea and vomiting are the most common side effects with all of these injectables.
Some people can experience diarrhea. They can experience constipation. There are a subset of people who have experienced some slowing of their gut or slowing of their intestine called gastroparesis. And there's some people that if they have a history of pancreatitis, it can be triggered.
The GI symptoms can happen at any time, but Shelley says you typically see them as people switch to a higher dose.
So if they're experiencing a lot of the nausea, vomiting symptoms, I would kind of decrease the dose for them and to see how they do. If it continues, then we may have to try a different medication.
Another common question, are these medications safe? Dr. Shelley says a 2023 study found that for patients with pre-existing cardiovascular disease, taking semaglutide, one of the weight loss medications, actually lowered their risk of dying from cardiovascular disease or having a non-fatal heart attack or stroke.
I do tell them that this is safe, especially in people that have pre-existing cardiovascular disease. And so you should feel reassured that you're okay to take this medication for a long period of time, especially if you have no cardiovascular diseases.
And if you're wondering if you're a candidate, you typically need to have a BMI or body mass index of 27 or greater and a weight-related health problem like high blood pressure or a BMI of 30 or greater. And that brings us to our final question. Is this medication going to be covered by my health insurance?
That is a big question. And a lot of times, I'll ask the patient to call their insurance, but majority of the times we just have to submit it to the pharmacy and fill out the prior authorization. Because sometimes it's not quite clear whether insurance covers it or not.
Beth Galvin for the Fox Medical Team.